Based on the latest statistics on trends in cancer incidence and mortality worldwide, this new book reveals how the cancer burden is growing at an alarming pace and emphasizes the need for urgent implementation of efficient prevention strategies to curb the disease.
The current incidence of new cases of cancer each year worldwide is about 14 million, but just in the next 12-13 years, so by 2025, this will be over 20 million new cases per year worldwide.
Over the same period, cancer deaths are predicted to rise from an estimated 8.2 million annually to 13 million per year. Globally, in 2012, the most common cancers diagnosed were those of the lung, 1.8 million cases, 13.0% of the total, breast, 1.7 million, 11.9%, and large bowel, 1.4 million, 9.7%. The most common causes of cancer death were cancers of the lung, 1.6 million, 19.4% of the total, liver, 0.8 million, 9.1%, and stomach, 0.7 million, 8.8%. As a consequence of growing and aging populations, developing countries are disproportionately affected by the increasing numbers of cancers. More than 60% of the world's total cases occur in Africa, Asia, and Central and South America, and these regions account for about 70% of the world's cancer deaths, a situation that is made worse by the lack of early detection and access to treatment. One of the key messages of the report is that huge numbers of cancer cases can be prevented and avoided.
The big difference with this report compared to the previous one 6 years ago is, first of all, that we're seeing a very rapid increase in the numbers of cancers worldwide, but particularly in the low and middle income countries. So this shows us that cancer is truly a global problem, and that we're not going to be able to address this problem by simply improving the treatment of the disease. The second big change, I think, is the advance we've seen in the understanding of the biology of cancer. And now our challenge is to translate this new knowledge about the biology into better treatments, but also into ways to prevent the disease and detect it early.
The CyberKnife robot represents the highest available technology for precise radiotherapies, protecting as much as possible healthy cells around a tumor. With this robot, all rays required for a treatment can be applied from all possible angles around the targeted cells in the body. Using so many angles allows that other cells are crossed only once during a treatment session. Meanwhile, Vietnam is one of around 80 countries that have received assistance from the International Atomic Energy Agency (IAEA) in cancer control. After cardiovascular diseases, cancer is the second leading cause of death in the country. According to the latest statistics from the World Health Organization (WHO), there are around 125,000 new cancer cases and 94,000 deaths each year in Vietnam. These figures are expected to double by 2035. The IAEA has helped Vietnam to acquire equipment and has provided training for health professionals in all aspects of cancer control. Every year, on the 4th of February, the IAEA joins other international organizations to mark World Cancer Day. This year's theme, Debunk the Myths, offers an opportunity to improve general knowledge about cancer and dispel misconceptions of the disease. IAEA Director General Yukiya Amano visited cancer treatment facilities in Hanoi. Cancer has reached epidemic proportions worldwide. The disease kills more than HIV/AIDS, tuberculosis, and malaria combined, accounting for nearly 15% of deaths globally, and the numbers are rising.